How to choose the best mouthwash? When we talk about dental hygiene, we recommend the use of mouthwash. But what is mouthwash? Mouthwashes are a liquid solution or rinse that acts around the teeth, gums, and tongue. They are a tool in daily dental hygiene without implying that it replaces brushing. What is the function of a mouthwash? The purpose of mouthwashes is to help control or eliminate certain risks and fight bacteria. We find different indications: improve breath, prevent plaque formation, complement to brushing, fight caries, improve or prevent gingivitis. What types of mouthwashes are there? The U.S. Food and Drug Administration regulates mouthwashes as either cosmetic or therapeutic. Cosmetic mouthwash. This type of mouthwash is available over the counter to be used to control bad breath, leaving a pleasant taste in the mouth, but it does not have the particular application, nor does it help fight plaque or bacteria. However, this mouthwash helps remove food debris that remains after brushing and leaves the mouth feeling clean. However, this effect is short-lived. Therapeutic mouthwash. These mouthwashes have active ingredients that offer multiple benefits. They are used according to the formulation indicated by the dentist for the prevention or relief of different diseases. What ingredients and their effects do the mouthwashes bring? Alcohol mouthwashes. This agent is common in many mouthwashes, but it does not have a specific action. Rather, the main objective is to help dilute the active ingredients in the mouthwash. Rinses with chlorhexidine. This is the most widely used antibacterial element in mouthwashes and is widely indicated in gum diseases. Rinses with fluoride. This type is recommended for people at high risk of dental caries, such as those with orthodontics. Rinses with peroxide. This substance is present in many cleaning products in the home and has antimicrobial action. It is safe in concentrations of 1 to 3%. However, if not properly diluted, it can cause the nerves to become infected and eventually die, causing something called pulpitis. How should the rinse be used? If the mouthwash is not used correctly, it can mask other health problems. For this reason, we recommend the following points when using it. Use the right amount. Swish vigorously with your mouth closed. Do not swallow it, spit it out. Consult with your dentist for the best option. Mouthwash does not replace brushing. Hold it in the mouth for 30 seconds. Use it an hour after brushing. The use of a rinse is not always required for good oral hygiene. Check the active ingredients as directed. Do not consume food or drink or smoke within 30 minutes after the rinse. Thank you very much for what you have explained. If you have any questions about this or other topics, you can contact us at Channel Island Family Dental as well as our Facebook page. We look forward to your visit, and we will make a timely diagnosis. Our dentists in Oxnard, St. Paul Adventure, Newbury Park, and Port Hueneme will be able to guide you towards the best treatment to take care of your health and give you back your best smile.